Okay, we are going to start our lecture on ethics and values, chapter 43. So what are morals and what are ethics? Okay, so ethics is a formal process for making logical and consistent moral decisions. Okay, morals are private, personal, or group standards of right and wrong, right? So morals consider in a broad, general manner what is good and bad, what is right and wrong, right? For example, in general, it's wrong to steal, right? And so ethics, in differential to that, is a systemic study of right and wrong context. Okay, so ethics would answer the question, morals say in general, it is wrong to steal. Ethics would say, but is it wrong to steal if you have to do it to feed your children? Okay, so ethics uses specific rules, theories, and principles and perspectives to inquire into that justification of a person's actions in a particular situation. So when we talk about nursing ethics, we're talking about these questions right here. So what is your level of participation going to be in a given ethically challenging situation, which you are bound to come into contact with in your nursing career? Can you support clients' decisions based on their ethical beliefs, even if they differ from yours? And what are your feelings about the results of decisions made by others? Okay, so these questions are just to help you focus on the principle here that there are no right or wrong answers when discussing ethics. Okay. So we talk about a compromised ethical agency. We're talking about moral distress versus moral outrage. Okay, so in moral distress, this is the inability to carry out a moral decision. Okay, there may be some constraints that you see in your situation. So maybe a physician is in your way to carry out this moral decision, or maybe nurse administrators would frown upon it, or other nurses. Okay, maybe there's a law against it or threats of a lawsuit, but you are morally in distress because you feel like you need to make this decision, but there are these constraints in your way, right? And then there's moral outrage. So moral outrage is the belief that others are acting immorally. So it gives you feelings of powerlessness because there's a wrong happening and you cannot prevent it. Typically, you respond with whistleblowing with moral outrage. So let's talk about whistleblowing. Whistleblowing is the identification of an unethical or an illegal situation, and it can involve one person or an entire organization. Okay, so a whistleblower is to be a person who reveals information about the practices of others that he or she reasonably believes is corruption, mismanagement, fraud, abuse, illegal, or harmful to the health, safety, and welfare of the general public. Okay. Reporting such an action to someone in authority is what they do, but you've got to have accurate information and proof, right? You need to consider the nature of the action, the likelihood of immediate harm to the patient, the accuracy, and the completeness of your data. Because if it involves an immediate threat to the health, safety, and well-being of others, then you should report it immediately. But in other situations, you should follow the think method. So this means T for talk to an attorney or other legal representation. The H is have concrete and credible evidence. The I is institute a survival plan if your job is put in jeopardy after you're fired. The N is for note the nature of the consequences of the problem. What's the type, the severity, or the impact? And then K, know your reporting options and support systems. Okay, think before you act. The systems involved can correct the problems, but you have to weigh the risks and benefits, right? The American Nurses Association is working to protect whistleblowers. So other ethical problems for nurses. So consumer awareness or informed consent. So as a result of increased consumer awareness with the availability of the information online, professionals are now expected to share knowledge with patients and to obtain truly informed consent for treatments, right? So in some cases, consumers are demanding treatment that's not medically needed, right? So we have to get informed consent. They have to be aware of the risks and the benefits of their procedure, okay? Technological advances. So with every new technology, new issues arise. For example, in vitro fertilization and embryo transfer methods have brought forth questions about what should be done with embryos that are not implanted into a uterus. Are they able to be disposed of? What is their status as persons, right? That's an ethical problem right there, right? An ethical problem. Like we can, but should we, right? So then we have multicultural populations. So you're going to work with patients and colleagues from a variety of different cultural backgrounds. They probably hold very different sets of values. So you're going to need to respect a variety of belief systems and serve as a patient advocate, even when your patient's value system is very different from your own. Okay. And then cost containment. So the emphasis on cutting healthcare costs creates many morally questionable decisions. For example, patients who are being sent home from the hospital while they are still very ill. On being discharged, they may discover that insurance payments are limited for services outside the hospital, including specialists, home care, medical supplies, things like that. So people have unequal access to healthcare because of the cost. And then the nature of nursing work. Ethical problems exist in all kinds of work. However, the nature of nursing work can create unique ethical problems. So a nurse's ethical problems are going to be immediate, serious, and they're going to be frequent. In the classroom, you have the luxury to leave questions unsettled, but in the real world, you must always decide. You either take an action or you do not, right? For a nurse, deciding not to act is in effect, it's an act as well, right? Not acting is also an act. Nurses' unique position in healthcare organizations, because nurses have multiple obligations and relationships that can help create conflict and loyalties, conflicting loyalties, right? And then the nature of the nursing profession in general. So some ethical problems arise because of value conflicts and a lack of clarity within the nursing profession. We have unresolved questions about nature, scope, and goals for our practice, as well as our professional values. In most of the following examples, we value both of the opposites, okay? We would not wish to give up either one, but specific situations require us to choose between them. This can be a source of discomfort. So such as issues like this, caring for versus spending time with clients. So nursing values caring, humanistic care, and the nurse-client relationship, but nurses now spend less time at the bedside than ever before. One reason is understaffing. One reason is heavier client loads. But then there's other factors like the use of technology or the need for careful documentation, things like that. Another one would be autonomy versus escaping hard choices. So on one hand, we believe that nurses should have an equal status with other healthcare professionals. But on the other hand, many nurses are uncomfortable making hard choices and prefer to let the provider decide. Another would be higher pay versus cost effectiveness. So most nurses believe that we deserve higher pay, yet we claim that nurses are cost effective because we work less expensively than other primary providers. And then professionalism versus caring. So we claim that the nurse is professional, citing critical thinking, knowledge, and management skills, yet we emphasize caring with the nurse at the bedside offering comfort and doing hands-on tasks, right? So all of those things come into play. So then factors in ethical decision-making. We have to consider values. So values are ideals, beliefs, or customs, modes of conduct, qualities, or goals that are highly prized or preferred by individuals or groups or society, right? You can value an idea, a person, a way of doing things, or even an object like money, right? People express values through behaviors, feelings, knowledge, and decisions. For example, the nurse who values compassion will interact with patients in a sensitive and caring manner. Okay, they vary from person to person. They can change over time. We choose them, right? They're learned also through observation and experience of our upbringing. Attitudes also play a factor. So attitudes are going to be mental dispositions or feelings towards a person, object, or idea. Attitudes can be cognitive, where we think about them. They can be affective, where we feel them, or they can be behavioral, where we do them. For example, you may have a positive attitude about cleanliness, and that is, you may think it's a good thing, Like the floor is clean, that's nice. But if you value cleanliness, you would be willing to scrub the floor, right? You would also wash your hands at appropriate times, bathe regularly, and teach others about hygiene as well. And then beliefs are a big factor as well. So beliefs are what one accepts as true. So for example, I believe that germs cause disease and that by washing my hands, I remove the germs, right? Beliefs are sometimes based on faith and they're sometimes based on fact. It may or may not be true, and it may or may not involve values. Excuse me. So what are ethical frameworks? So consequentialism. This is the rightness or wrongness of an action depending on the consequence of the act rather than on the act itself. Okay, so theories of this type are also called teleology, from the Greek word telos, meaning the end. Okay, that's what teleology is. So utilitarianism. This takes a position that the value of an action is determined by its usefulness of the action. So the principle of utility states that an act must result in the greatest good or positive benefit for the greatest number of people. Any act can then become a good ethical choice if it delivers good results. And then deontology. This is almost the opposite of the utilitarian model in that it considers the action to be right or wrong regardless of its consequence. So decisions are based on moral rules and unchanging principles. That's deontology. And then there's ethics of care. So this is the nursing responsibility to care in ethical situations, right? So nurses include a responsibility to care as part of their professional behavior. Some aspects of care include the ability and the duty to appreciate, to understand, or to even share a patient's pain or condition, okay? Using a caring framework, your ethical analysis would focus on relationships and client stories. We need to know in our nursing care of ethics that patients they have a right to experience privacy. They have a right to experience dignity, okay? And then ethical principles, okay? We're gonna go through the definition of these. They're red, which means you probably should know them. So what is autonomy? Autonomy refers to a person's right to choose and the ability to act on that choice. It is based on respect for human dignity, okay? You need dignity. You demonstrate respect for autonomy when you treat patients with consideration. You believe their stories about the course of their symptoms and their illness, and you protect those who are unable to decide for themselves. Next is non-maleficence. This is the twofold duty of do no harm and also prevent harm. Okay, non-maleficence refers to both actual harm and a risk of harm, as well as the intentional and unintentional harm. Okay, so in nursing, it's rare to find intentional harm, but unintentional harm due to lack of careful planning or neglect does occur. So unintentional harm can also occur because of lack of knowledge or skill or ability, right? So that's non-maleficence. That's the duty to do no harm and to prevent harm. Beneficence, this is the duty to do or promote good, okay? You can think of this principle as being on a continuum with non-maleficence, but at one end of the continuum is the duty to bring about positive good, which is beneficence, right? And at the other end is the duty to do no harm, which is non-maleficence, right? Then there's fidelity with it, which is faithfulness, the duty to keep your promises. It's a basic part of every patient situation. If you tell your patient you're going to be right back with ice water and then you leave and you do come right back with ice water, that creates a sense of fidelity or faithfulness. Veracity is the duty to tell the truth. This seems straightforward and you may wonder why it even needs discussion, but most nurses would agree that it's not hard to tell the truth, but at times it's very hard to determine how much of the truth to tell, okay? And then justice. This is the obligation to be fair. It implies equal treatment to all patients. Questions of justice will become a part of your everyday experience in patient care, from deciding how to allocate your time among your patients to larger decisions such as how to allocate limited healthcare resources as well. And your clicker check. So the client has right-sided hemiplegia, right? So that means they're paralyzed on one side as a result of a stroke. And they want a cup of hot coffee. So even though the client is insistent, the nurse does not permit her to drink the coffee unsupervised. This nurse is using the ethical principle of what? Autonomy, fidelity, non-maleficence, or justice. The correct answer is C, non-maleficence. So while this is a simple example, the nurse is actually decreasing the risk of harm or a burn by not leaving the client alone with hot coffee. Note that in this instance, the nurse judged the principle of non-maleficence to be more important than the principle of autonomy, right? And we are free to make those decisions. That's why we try to teach you how to critically think. And then the process for ethical practice. So we have to clarify your values. So this refers to the process of becoming conscious of and naming your own values. If you're clear about your own values, you're going to be more able to make good decisions and to avoid imposing your values on others, because everyone has their own unique sets of values, and it's important for you to appreciate how others' values influence their decisions. You need to identify moral and ethical dilemmas. So when a choice must be made between two equally undesirable actions, that's what an ethical or a moral dilemma is, right? When a choice must be made between two equally and undesirable actions, okay? Only problems that pose a question between competing and equally valuable interests are true dilemmas, like we talked about. So in order to get through that, you need to make a decision-making model, okay? Use MORAL or moral to get through that. M for massage the dilemma, right? What is it? O for outline your options. R for resolve the dilemma. A for act by applying your chosen option. And L, look back and evaluate. How did it affect the patient? You're also going to look for a compromise. So even if you believe that you know the right thing to do, others may not agree with you, or there may be constraints that prevent you from doing it. Many times it will be possible to reach a good compromise. A good compromise is one that preserves the integrity of all parties. This means that the discussions are carried out in the spirit of mutual respect and all viewpoints are respected and considered. Okay. Also, you have the option to participate on an ethics committee. Ethics committees develop guidelines and policies and provide education and counseling. And in the case of ethical dilemmas, it reviews the case and provides a forum for expression of the diverse perspectives of everyone involved. That could help you get through that. And then also work on improving your ethical decision making. So research has found that when faced with ethical dilemmas, nurses tend to use conventions like rules or procedures as the criteria for making their decisions rather than the client's personal needs and well-being. Okay, a full spectrum nurse must move from the conventional to the post-conventional stage of moral development. This is considering reasoning versus rules. Okay, use your theoretical knowledge, use your self-knowledge, use practical knowledge, right? While you're still a student, ask to attend an ethical rounds or ethics committee meeting. Consult reliable sources, share it, evaluate it after you get a situation resolved, evaluate your decision-making, right? And these are all steps you can take. And that concludes our lecture on ethics.